I assume everybody can see my screen. You cannot, just give me a shout. And I will make sure that everyone can see. All right, so let's go ahead and get started. Just being mindful of everybody's time. No, it's the holiday again. Appreciate the few people that did join. So thank you very much. I feel like this session that we're going to talk about today is very important when you're talking about permanent supportive housing and trauma. So today I'm going to talk about trauma-informed care in permanent supportive housing. And for those of you who do not know who I am, I'm Nikki Stevens. I am a senior consultant at Advocates for Human Potential, also known as AHP. And my jam is housing and homelessness. I have many years or a couple decades of experience in delivering permanent supportive housing to people who have experienced homelessness that also are living with a serious mental illness as well, including people with chronic homelessness. So I've done outreach. I have been a housing director, so I have a broad range of research and professional experience in regards to this subject. In today's learning objectives, we're going to talk about understanding trauma and its impact on housing stability, applying trauma-informed care principles into your permanent supportive housing program, how to strengthen collaboration with your property management company, as a lot of the programs that you all run are utilizing scattered site model, where you're working with outside property management companies. And the fourth is to promote staff wellness to prevent secondary trauma. So let's talk about trauma. What is trauma? So trauma is a deeply distressing or disturbing experience. We've all had some sort of trauma that's happening to us or happened to us, and it does affect how we move in the world and how we interpret things and how we absorb information. So it can be a one-time thing, like a car accident, or, something that's happened to you, or somebody passes away, or, those types of traumas. There's also that repeated trauma when you think about abuse that happens to folks. Also, there's complex trauma where there's abuse, neglect, you know, um, all kinds of stuff going on, and we'll talk about that a little bit later. And it could be chronic trauma. And we know from scientific evidence that trauma does affect our bodies in all different types of ways. And that includes our brains, like I said, our bodies, our emotions, our relationships with people. So trauma affects all aspects of our lives. We sometimes think that something happened to us and, we moved on, but sometimes we have trauma that comes out in different ways and affects our bodies in different ways. And sometimes you feel like, why did I react to that way? It could be from a past traumatic experience that you had. And there are three E's of trauma. There are the events that happen, the experience from those events, and then, of course, three being the effects of those events. And I also want to say, I can't see the chat. So if you have questions, just raise your hand or come off mute. And also if Crystal, if you could let me know if there's anything that comes up in the chat. Hate to put that on you. If there's something that comes up in the chat that needs to be addressed, please let me know. I'm happy to pause and answer any questions. And there's, like I said, there's three types of chronic, types of trauma. There's acute trauma, like that single event, like I talked about, an accident, an assault. And the relevance to the permanent supportive housing is that can trigger anxiety or flashbacks for people. So you don't know why somebody's behaving this way or reacting this way. And then there's a chronic trauma. That's an ongoing exposure to trauma. That's abuse that's happened for a long period of time, or even homelessness. We sometimes forget that homelessness is trauma, and I will go into that a little bit later. And the relevance to permanent supportive housing is because it creates a sustained distrust and it creates emotional exhaustion. People who've experienced homelessness are coming in with complex trauma, emotional exhaustion from dealing with whatever's going on, what's going on before they become homeless and what's going on during their time of homelessness. And again, there's complex trauma. And that means there's multiple traumas that have occurred to someone. And it could be all three, an assault, it could be long-term abuse, it could be homelessness, it could be all of those things. And then we talk about the relevance to permanent supportive housing. It creates challenges in relationships, not only with, your family or friends, but also, your neighbors, right? Or with your care team, your housing specialist, your, case manager, whoever that is. And it people have a hard time regulating their emotions. So there's emotional regulation that happens through complex trauma. So, what is trauma-informed care? So, trauma-informed care incorporates these six core principles that include safety, trustworthiness and transparency, peer support and mutual self-help, collaboration and mutuality, empowerment, voice and choice, and then also cultural, historical, and gender issues. So I mean, you can come off mute or put it in the chat or raise your hand just to tell me if any of you heard of ACEs, which is called Adverse Childhood Experiences. And so ACEs it refers to traumatic events or chronic stressors that someone has experienced from the ages of 0 to 17 years old, that they can have a negative impact on a child's development, and then that carries over into risky behavior as an adult. I know for myself, any of us can take this. It's really a super simple 10 question, scoring tool that you can use. And the link is right here. Where you could see where you could take the test yourself. It's super simple. But also for me, I think I scored a 2 or 3. And just for me, it gave me an idea and understanding of what the people I'm serving may be dealing with, some of those questions. So ACEs is extremely common, high ACE scores. The Center for Disease Control and Prevention says that 61% of US adults surveyed across 25 states report they've experienced at least one type of ACE before the age of 18, and 1 in 6 report they have a score of 4 or more. ACEs are considered major risk factors for homelessness, with a higher prevalence of ACEs found in homeless populations compared to the general population. So some of those areas are abuse. That could be physical abuse, sexual abuse, verbal abuse, emotional neglect, physical neglect. Growing up in a household where the adults had alcohol or drug problems, or especially alcohol or drug substance use disorders. Also, there were mental health needs of an adult in your household. There were you were witnessing domestic violence, or you had an adult in your life who spent time in prison, or your parents have separated. So those are the three common areas. And trauma in the brain. So this is very important because often we forget, like, hey, somebody got housed. They should just be all good now. Everything's good. We got them housing. What's the problem, right? But people are still in fight or flight mode, right? So the amygdala part of your brain, that's the fear and survival center of your brain. So that affects how somebody responds based on the trauma that they have experienced. And there's the hippocampus, which is the memory integration. So think about domestic violence survivors, think about people who have been physically or sexually abused as children, and think about how part of their memory is affected by those, and also the amygdala, how that's affected because they're in fear or survival mode. And there's also the prefrontal cortex, that's your decision making, right? That's this part of your brain, the front end. And we also think about our veterans who have PTSD, who have served in wars, and the prefrontal cortex of their brain, their decision making, or even like young adults where we're like, why do they keep making these dumb decisions? Because their brain is not fully developed, or they could have a traumatic brain injury. There's a lot of reasons why people make the decisions they make. I just want us to remember that when we say, oh, well, I told them not to do that, and somebody does it, there's something going on that may be trauma related, either physical, emotional, or behavioral. And trauma keeps people in survival mode, right? Because could you imagine when you're experiencing homelessness, you're in that constant survival mode. Your brain is overactive, right? You're constantly worried about what's going on, where's your next meal, where you're going to sleep at, if somebody's a danger to you. So people are in survival mode. It's that fight, flight, freeze, or fawn response. So how does homelessness cause trauma? So trauma, instability, homelessness equals more trauma, right? So there's exposure to violence. So we often think that people who are experiencing homelessness are violent, and that is just not the case. They are more likely to experience violence themselves than to actually be a perpetrator of that violence. So people experiencing homelessness are at higher risk of assault, theft, and sexual violence. Women, trans people, and unaccompanied youth are especially vulnerable. And we know this to be the case. There's multiple studies that show this is the case. And the lack of safety and privacy. Living in public spaces or shelters often means constant hypervigilance, right? Constantly worried about what's going on, constant surveillance, lack of control over what you can do, where you can go, and what time, and limited protections from harm. I've talked to many people who've experienced homelessness, both youth and trans, and that's why we're sometimes, well, why don't people just go to shelter? Well, because often it's a survival mechanism. They've been assaulted at this shelter, or they're treated a certain way at a shelter, or youth have been stalked at a shelter. There's many reasons why people don't actively seek emergency shelter. There's also that institutional trauma. That's frequent encounters with law enforcement, or they've been incarcerated. We know youth who age out of child welfare systems. The healthcare systems can re-traumatize individuals. And there's also the encampment suites. We know what's going on right now with the encampments and what's happening with the Grants Pass decision, and how that uh, has affected a lot of people who've experienced homelessness, because there's encampment sweeps coming in, law enforcement are coming in, there's forced displacement. So think about you as a child, if you had to constantly move, or you were evicted as a child, and you're experiencing homelessness now, and somebody comes into your encampment, which is someone's home, whether we agree with it or not, that is their safe space. And that causes trauma when we displace them. And it can mirror those past traumas like domestic violence or abandonment or evictions or homelessness as a child. And a lot of children or adults who experience homelessness now have experienced homelessness as a child as well. So making that connection between trauma and homelessness, we know family disruption, abuse. Many people, especially youth and young adults, leave home due to violence, right? Neglect or rejection. We know a lot of LGBTQIA plus youth leave home because of these things. Domestic violence is one of the leading cause of homelessness among women and families in our country. There's also the mental health and substance use disorders. Trauma can lead to post-traumatic stress disorder, anxiety, depression, substance use. These are all coping mechanisms, right? Uh, because of what's happened. And these conditions can disrupt employment, relationships, and most importantly, the housing stability. And we're talking about systemic trauma and discrimination. There's structural racism, poverty, and criminal justice involvement can compound those traumas and limit the access to housing and services that we're most definitely seeing across the country. Indigenous and Black communities are disproportionately represented in the homeless populations due to these historical and I can't talk today, intergenerational trauma. So I want to talk about the 6 principles of trauma-informed care. Any questions why I'm pausing for a moment? Okay, then we'll keep going. Okay, principle 1 is safety. So the key points of safety and trauma-informed care in PSH is the physical and emotional safety are foundational. So that's why choice is so important. When somebody gets to choose where they live, you are giving them back some of their power that they may have lost in the past, especially if they have cycled through child welfare systems or incarceration or emergency shelters. So it also, predictability and clear boundaries help people feel secure, right? And sometimes we put people in environments that don't make them feel, comfortable or secure or safe. So environmental design matters too. So when somebody chooses where to live, is there enough lighting? Do they have privacy? Locking I've spoken, like I've done this for a long time and I've done homeless outreach as well. And speaking to people about the ability to just lock your door is a different level of security a lot of folks can feel. So safety is extremely important when we're talking about trauma-informed care. An example question that you could ask someone is what could make a space feel safe or unsafe for residents? So, when somebody's moving in, is their apartment in the dark corner? You don't know if they've been attacked in the past. You don't know, are there street lights? Are they have the ability to be able to feel like it's a safe space? Just to think about. And principle two is trust and transparency. Keeping commitments and follow through. I often used to tell my staff, under promise and over deliver, right? So do not promise people things, but try to over deliver on things. Like, try to do as much as you can to build that trust and rapport and explain the processes clearly and early with folks. So a lot of times too, when we're talking about trauma, people are in survival mode. You're like, here, sign these papers, sign this lease, sign this, sign that. And sometimes people don't understand what they're signing. We push things fast and quick because you have 20 or 30 other people on your caseload that you have to deal with. And sometimes we don't explain things clearly and early on. And oftentimes, I have a master's degree. I don't know about you all, but reading a lease is very difficult. And you want to make sure that people understand what's in that lease, what their responsibilities are, and how that can affect their tenancy if they do if they have a lease violation. So making sure that you're communicating that to folks. And also not forgetting that sometimes folks may be illiterate and cannot read or cannot understand that, or may have a traumatic brain injury. There's so many what ifs, and I've talked to a lot of folks who've experienced homelessness or have come out of incarceration, and there's a shame attached to not being able to read, right? And understand things. So making sure that you don't create more additional shame for folks and you're explaining things to people that they're able to understand and absorb the information and meeting them where they're at. Avoid surprises, communicate changes. Any changes that are going on with your team that you may not be able to show up, who's your backup? Have you be able to introduce that person to the other person on your team? Does the person in your program know who to contact if you're not available? All those types of things. So don't, just disappear on somebody. Making sure you're developing that trust and transparency. Just an example, like we're going to have an inspection next week. Let's plan this together. Let's make sure that you pass your inspection, the HQS inspections that happen on a yearly basis. So making sure that you're communicating that early on. Also, principle number three is extremely important and close to my heart is peer support. I don't think we give enough credit to how integral and important peer support is in permanent supportive housing and ending homelessness in the work that we do. So peer support is extremely valuable and important when we're talking about trauma-informed care. Lived experience builds that connection and hope for folks. People can see other people who've experienced homelessness who are doing this work and they see the potential in themselves because of the work that our peers do. So peer staff model that recovery and that resilience and that ability to say, hey, why can't I do that too? So encourage resident-led activities if you are in a project-based program where you have a bunch of units, get the residents to lead activities. Get the residents in your program to identify things that they think that would be good for the community. It actually is a good model. And peers are the heart of this work. So principle four, collaboration and mutuality. So the key points here are the with instead of for language, right? We're doing stuff with and not for people. So we're supporting them along their journey, but we're not doing it for them. And staff and residents share power in decision making. It's not going to be like, well, Nikki said you got to do this. It's what that person wants to do, what that person needs, what decision do they want to make. And you create problem solving partnerships that way. Reflect on ways you can reduce the us versus them dynamic. Principle 5 is empowerment, voice, and choice. So the key points here is to offer real choice in people's goals, the services that they want to receive, and their interactions. So does this person want to be seen once a week, twice a week, once a month? Sometimes I know programs have their own iteration of this, but just thinking about what that is. And my goals should not look like Crystal's goals or like Sarah Lynn's goals. We all have different goals. We all have different things that we want to do. So everybody's goals should be different, and and everybody's services should be different, because what I want and need may not be the same as what Crystal wants or needs. So also you want to reinforce self-efficacy and control, making sure that you're empowering people to make those decisions for yourself. And also celebrate progress, any little thing, celebrate the small successes, because it leads to bigger successes, and it leads to it also helps people increase their self-esteem, right? Celebrate their progress and their self-determination to make those decisions. And principle 6 is humility and responsiveness. So the key point here is recognizing identity, culture, and lived experience. Everybody has a different lived experience based on how they grew up or what their background is, what their religion is, all of those types of things. So we want to recognize that. It's not there's nothing bad to recognize that and say that we all know that we are not exactly the same. And it also acknowledge the power differences. Like whether you think about it or not, there is a power differential going on between yourself and the people in your program. You hold something important over them, and most likely it's their housing. And so it's important that you acknowledge those power differences. And ask open questions like, what does support look like for you? Not what support looks like for me, but what it looks like for you. So making sure you're asking those questions to them. And also it's important in your community, identify those culturally responsive services. You could just have them in your Rolodex. That's an old term. You can have them in your phone, or you can have them somewhere where you know that if somebody wants a culturally relevant service or religious relevant service, that you know where to find it. You already have that information. And you can even offer it up saying, hey, here's all the stuff that we have to offer. Just making sure that people understand that it's not monolithic, and it's no one size fits all. And reflect on your own implicit biases. We all have biases. And when someone comes into our program, you know, we, we all think about people, about the way they look, the way they think, the way they dress, whatever that is. We all carry those implicit biases with them. So reflect on those and making sure that you're not judging people based on the way they look or their experiences. So the intersection of permanent supportive housing, homelessness, and trauma. As I indicated earlier, the high prevalence of trauma, many individuals experiencing homelessness have faced significant trauma, including physical abuse, emotional neglect, domestic violence, and community violence. And trauma can impact an individual's ability to trust, form relationships, and engage with services or support. So how does that impact the housing environment? Because permanent supportive housing can be a crucial setting for someone's recovery and for their healing if it's designed with trauma-informed principles. So it's important that trauma-informed care is integrated into your permanent supportive housing programs, because you don't want to inadvertently re-traumatize someone when you're trying to create a safe environment for them, to recover and be, integrated into the community. And certain environments can inadvertently re-traumatize residents, causing stress and destabilization. And permanent supportive housing is a safe place, should be a safe place for healing, right? A trauma-informed PSH program fosters an environment that supports emotional well-being, stability, and someone's growth. And so how does trauma impact someone's tendency? Because a lot of times we think, well, we got them housing. Why are they mad at us? Or why are they behaving this way? And why can't they just be happy or whatever the case is? Again, they haven't dealt with their trauma yet, right? That's why, the housing first principles, thinking about, you put somebody in housing, then you wrap those services around them because you don't know what those services are. Let's just get them safe, right? So some of the areas that a lot of folks you'll see that you serve, there's avoidance or mistrust of staff because we don't know what somebody's trauma is. And we don't know why they may have a lot of mistrust based on what their experiences are. And sometimes they have difficulty following program rules. And again, thinking about trauma and how it affects people's brains and memory and their ability to have good decision making. So sometimes it's difficult for people to follow program rules. Sometimes we stuff a bunch of program rules in front of somebody and expect them to like, oh yeah, I'm gonna just do all of these things and not explain them clearly. And I also wanted to remember that we should meet people where they're at and putting things in their native language, or maybe they need visuals. Maybe we all learn different ways, auditory, visual, hands-on. There's all different ways we learn. So making sure that you're meeting people where they're at. Emotional dysregulation, conflict or withdrawal. Some people are very conflict avoidant, and some people are ready to, get into it. So as we know, a lot of times we put people in apartments and we expect, oh, good, they're in an apartment, but then their neighbor's blasting the music and this person's triggered and they go and banging on their door or they yell at them to cuss them out or, then they get a notice and, all of that stuff happens. So emotional dysregulations can affect someone's tendency because if I'm banging on the walls or I'm knocking on people's door or I'm blowing up at people, that's going to affect me being able to adhere to my lease. Uh, there's also the executive function issues, as we talked about, memory, organizational skills. A lot of times we expect people to understand these things. We move people into apartments and we expect them to be all good. We got to remember that sometimes, especially if you're dealing with people who've experienced complex trauma or who have chronic homelessness, which chronic homelessness, the definition is 4 more years of homelessness or 1 year of continuous, 4 more episodes of homelessness or 1 year or more of continuous homelessness, but also with a co-occurring or disabling condition. So these are folks who are or who have experienced homelessness for an extended period of time, but they also have a disability as well. So that executive functioning may not be the same as you or I. So just thinking about someone's memory or their organizational skills and walking through things with someone so they're able to understand because it could affect their ability to keep their tenancy. And also there's the re-traumatization through rigid systems because we always want to just make sure we'll just follow the rules and just do it exactly like this. And sometimes that's a re-traumatization for someone, people who've been in the military or people who have been institutionalized in hospitals or in prisons or in a shelter. So just thinking about those things. Also, thinking about trauma-informed communication. You do want to validate someone's feelings. You do want to offer people choices, and you also want to use a calm tone and body language. If you step into somebody's apartment, your hands are folded and you're looking at them like, what are you doing? Who's going to be comfortable, right? That is your body is your communication, your body language, and behavior is communication, right? So using a calm tone and body language with folks is so important in a trauma-informed program. And avoid demands, threats, or judgmental phrasing, right? Don't demand, say, you better do this or you better do that. And don't threaten them with their housing and don't be judgmental based on the behaviors that they do. I just want you to always remember, there's a saying that goes, instead of when somebody acts out, instead of saying, what is wrong with you? I often think, what happened to you, right? It's about why somebody responds the way they do based on what's happened to them. So some examples of saying, what's been going on? We see you did not pay your rent in time. Why didn't you, instead of why didn't you do this? What's been, just saying, hey, what's going on? I see you didn't pay your rent in time. Is there anything I can help with? Do you need help with doing the cashier's check? How can I assist you? All those types of things. So just thinking about your communication style instead of in the way that you speak to folks. And I also want us to remember, thinking about that and paying rent, thinking about if someone hasn't been in a house in a very long time or they've never had their own place of their own, do they even know how to pay their rent, right? Do they know how to do a cashier's check? Do they know how to go on the internet to do these things? Do they know how to, even within their own homes, do they know how to turn on the stove, clean their toilet, take out their garbage, things like that. We need to keep in mind as well when we're thinking about supporting people in permanent supportive housing. De-escalation and crisis response. Stay calm, okay? Because there's gonna be times when people blow up at you. So you want to stay calm and maintain your safety. Never blow. You always be able to see an exit and be able to get out of a situation if it does escalate, and use grounding space and time, you know, just kind of breathe and if somebody's, going off, allow them that space. Don't get into it with them. Don't go back and forth with someone. You're the professional. You just need to de-escalate the situation. And after the crisis or blow up or whatever it is, you want to debrief with that person and restore the trust back with that person. Because for prevention equals relationship plus predictability. And also collaborating with the property management company, you have the shared goal, right? The property management company doesn't want to go through the eviction process. It costs them a lot of money, or they don't want to evict someone. So, having joint meetings with the landlord, or when you're going to visit your client or your program participant, go visit the landlord too and stop by and say, hey, how are you doing? What's going on? Everything good here? How's Johnny doing? Are they doing well? All those types of things, because I think it's for the property manager, it's good to see that you're there, you're active, you're communicating. And does your property manager know who to call if something does happen? What if I'm on vacation? Who does your property management call? So making sure you're collaboratively working with your property management company and also using trauma-informed language. Don't say, Johnny, he's seriously mentally ill, or you're not going to use that type of language with the landlord. You're going to remain professional. This is a tenant, just like you or I, and should not be treated any differently. And nothing about this person's diagnosis or their background should be shared with that property management company or landlord. And problem solving before lease violations happen. Be proactive, not reactive. Be on top of it, making sure you're checking in with the landlord and with the tenant, saying, hey, how's everything going? Do you know where the grocery store is? Do you know how to pay your rent? Do you know what your portion of rent is? Hey, landlord, is Johnny okay? Is everything good? Has there been anything happening? Because as we know, when somebody moves into housing, a lot of times they're going to bring their friends in there with them, right? Because there's some survivor guilt happening because the person that helped them on the street is still experiencing homelessness and they got their own apartment. They're like, hey, come live with me. So it's important that you're communicating early, not to have, unauthorized guests and things blowing up that way with friends of the tenant that could end badly. And also the staff boundaries and predictability. Boundaries equal safety and consistency, right? Over helping someone can erode that person's empowerment. You want this person to become independent. And if you're doing everything for someone, they're not going to become independent. They're going to think they can always rely on you and you're going to make sure you do everything for them. And communicate these limits clearly and kindly. Also, let's not forget about staff wellness. You all, if you're doing this work of housing and ending homelessness, um, I know because I've done it for many years how very difficult it is. And I know secondary trauma is real. And, I've hired a lot of peers in my career. And sometimes they can be triggered or re-traumatized with doing outreach or working with someone who's experienced homelessness because of what they've been through. Um, and that goes with people who have lived experience of substance use as well. So secondary trauma is real and feeling someone's pain, what they've went through. And some of the warning signs to look out for staff is that fatigue, right? They're fatigued, they're tired, they're also irritable, and the compassion has gone. They no longer have that spark they used to have for this work because this work is hard, and you all are special people doing this work, and we know we know this is not you all aren't in here to be millionaires, so I know that you're here from your hearts. There's also this numbness that comes over folks too, where they become numb to everything and they're no longer, being the compassionate people that they are. So just those are some of the warning time signs to think about. And it's important to prioritize your self-awareness. It's important to prioritize supervision with your staff if you are a team lead, or if you're not a team lead, that supervision with, going to your supervisor saying, hey, I'd like monthly or weekly or every other week check-ins with you. And also for our peers, doing peer check-ins together, with each other, supporting each other as well. Your wellness is extremely important. And some organizational trauma-informed practices include an audit physical spaces for trauma triggers, right? And you want to look around the space and making sure it's an inviting space. I often tell people if you're serving multiple populations, having, a rainbow flag can make somebody feel welcome, who may be LGBTQIA plus. Um, integrate trauma-informed care into your orientations, your supervisions, your evaluations, and use feedback from the residents or your clients or your program participants, whatever you all call them, and staff to guide those improvements for trauma-informed care practices. Ask yourself, where could we be more trauma-informed as a team? Any questions? I haven't checked the chat. Whoops. Okay, I'll keep going. So here's some of the trauma-informed supportive services. So we know case managers are extremely important and a part of this whole process. So a trauma-informed approach, case managers must understand the impacts, like we talked about, of trauma and work to build trust with residents. This involves empowering residents to make decisions about their own care and housing. And key features of a trauma-informed care approach as a case manager is to have individualized service plans or called ISPs. And you develop personalized goals that are resident-driven, flexible, and based on their preferences and needs and pace. And there's also the housing retention support. So providing regular check-ins and support to ensure housing stability, using a strength-based approach. And again, strength-based is important. Find out what the folks that you're serving strengths are, and that's how you build things out. And recognizing their own resilience. I mean, some of these folks have been through a terrible traumas and homelessness, and they're resilient and they're there. And we should applaud that. Crisis management training case managers to identify triggers and de-escalate situations effectively will without further traumatizing residents. Again, supportive services recognizes the value of lived experience and empowers residents to support each other and their healing journey. So those key features include peer mentoring, peer support workers who have experienced similar challenges, homelessness, trauma, help residents navigate their healing process, offering emotional support and guidance, community building, facilitating group activities, peer-led support groups. And if you don't have your own residents, identifying some drop-in centers or things like that in your community, or what we call clubhouses, things like that, where folks could go and obtain those peer support services and also participate as far as community building. Empowerment is important, so peer supporters encourage residents to take ownership of their journey and act as role models for personal growth and resilience. Substance use disorder treatment. Recognize that substance use is often linked to trauma, past trauma, and treatment should avoid punitive measures and instead focus on empathy, harm reduction, and rebuilding a sense of safety and self-worth. And these key features include the harm reduction model, which that are strategies that allow residents to engage in treatment at their own pace, right? Without the pressure to abstain immediately if they're not ready. Trauma-informed substance use counseling, integrate trauma-sensitive approaches to addiction counseling, focusing on the root causes of substance use. Oftentimes, we're slapping people in the hand for using the substances, but not dealing with the trauma that causes them to use those substances, right? So those trauma-informed techniques support people in recovery. And also, if you have MAT treatment, which is called medication-assisted treatment, for individuals struggling with opioid use disorders and other substance use challenges, if that's appropriate. Independent living skills, like I said, a lot of times we put people in housing and we're like, okay, we did our job, yay, yay, yay. But that's when the real work begins. And I often, if you guys have been through my series before, I talk about the first 90 days someone is in housing is probably the most critical part of somebody's journey. And it also is an indicator. If somebody could stay stably housed for those first 90 days, it's almost certain that they will stay throughout their entire lease term. So teaching life skills should be done in the way that empowers people, provides them with a sense of accomplishment, and also builds their confidence. So offering or trying to get people connected to skill building workshops that that are practical life skills such as budgeting, meal planning, job readiness, and conflict resolution. Employment support, that's so important. You guys have some amazing supportive employment programs in Washington. So assisting folks in their job search strategies, resume building, interview preparation, workplace readiness, focusing on fostering the confidence and self-esteem of folks. And there's also volunteer and community involvement. We often forget about this. If somebody can't work, maybe they want to volunteer. Animals is a great way to get people to volunteer and get integrated into the community. Look at your local animal shelters, see if they need support. A lot of times, folks that normally would not volunteer or get involved will help support animals. This has been a huge eye opener in a lot of the work that I've done. Like when I have done homeless outreach where folks would never come out of the river bottom, but then I offered a free clinic for their animals. So I had veterinarians come in and free shots and clothes for the dogs and cats and food and all this stuff. And people that normally would not come and offer services would come for services would come out from their encampments and actually participate. So just thinking about engagement, how do you engage somebody? Finding out what makes that person spark? Because it helps to rebuild that connection and they feel valued and they're a part of doing something in the community. Again, social services and community engagement, approach folks with compassion, avoid judgment, ensure that the residents' voices are heard in the decision-making process. And connecting to benefits, support folks in accessing their social benefits, which hopefully those are done at the very beginning when somebody comes into a program, food stamps, Medicaid, SSI, SSDI, help folks connect with local community groups, churches, and other organizations to build a sense of belonging and reduce isolation. There's also cultural and identity sensitivity, ensuring that services are culturally sensitive, including language access services, consider historical trauma, particularly for marginalized populations, people of color, LGBTQIA plus individuals, or our veterans. Crisis intervention services should focus on de-escalation and minimizing re-traumatization while offering emotional support in times of crisis. There's 24/7, the 988 number. If you guys aren't familiar with it, 988 is a national crisis hotline for folks. Have staff trained or partners available to assist residents during emergencies, behavioral health crisis, or medical emergencies, de-escalation training, ensure that staff are trained in de-escalation techniques to prevent residents from feeling cornered or threatened during difficult moments. And safe spaces, provide designated areas where residents can safely process emotion, stabilize during moments of acute distress. If this is applicable to your program, child care and family support services are extremely important. I worked at a family shelter for many years, and not having affordable daycare has kept a lot of folks from being able to integrate in the community or stay stably housed. So if you we don't often recognize how trauma impacts families, especially children. So family services should empower parents while providing safe spaces where children can thrive, family counseling, parental support, childcare services. Childcare services is one of the number one things that are needed when you're dealing with families who are coming out of homelessness, because it relieves that stress where people can go to their appointments, they can go look for a job, they can go get a job, and they have a safe place for their children to be. Recreational activities, we often forget how important it is for all of us to feel a part of the community, right? Is there a way that you can identify those activities that are going on in the community that are free or a very nominal fee? Yoga, meditation, art therapy sessions that help folks relax and build resilience and manage stress. Community outings, creative expression, provide opportunities, going to hear music or art or plays and things like that. So I will end with a quote. Trauma-informed care is not a checklist. It's a mindset, right? Every interaction is an opportunity to restore safety and dignity for everyone. And I didn't know if you all wanted to do a couple reflections with me. So, is there one thing that you would do differently starting tomorrow based on this training?
Nikki, I just want to thank you for there's so much I can't. I like as everything here has been applicable, it's just a brush up on realizing sometimes, oh, like I have a gal right now who we found her in the cold weather shelter. She's in our emergency shelter, which constitutes a motel room until we place her in housing. And we don't really know what to do with her because she's staying in the emergent or the cold weather shelter, and she's got a place of her own, but she can't have visitors there. And
Yeah,
she's got this new boyfriend, and he stays in the cold weather shelter. So it's been very challenging at best. And she's very, I mean, when I met her on outreach, she did not want to give me her name. In fact, she
yeah,
didn't. She was seeing another gentleman at the time, and he's the one that gave us her name, and we were able to offer her our housing program. But he literally drug her in there, and I'm still at bay as to how to go about this because there's her river. I always to call it the river runs really deep,
yeah,
because I don't like to call it chronic homelessness. It's just the river runs
yeah.
really deep,
That's
and
all
her.
that gave me goosebumps. That's a good way
Yeah,
to put
because
it.
my river runs deep in many
Yeah.
things, and so it's just I have a lot. This training, I just can no, it was a good brush. We're always doing retrainings on trauma informed care,
Oh, that's
but
great.
but it always it's this ever changing ball of because everybody's an individual and everybody's story is different, and so how to handle that individual within the guidelines of the program. And then,
Yeah,
commerce created the I'm sorry, the contracts. And so we got to follow those contracts and
yep,
finding a place within that contract for our individuals to not feel all these things you're telling us not to do, because it's not,
yeah,
and it's very, if anything, I get to walk away with, okay, a fresh, sorry, I'm getting cold, a fresh a reset on because I too get in that place where it's like, oh, and I've got like so many people on my caseload, I don't count so I don't overwhelm myself. But
Yep.
yeah, I've got a lot to think about, and I think that there's just a lot of things that the refresher in itself is a reset on going, okay, I got to stop. I've been really good at integrating people into helping with feeling a part of the community and
Yeah.
getting them involved because of working at the men's mission here and I'm in Everett, Washington. So, and that trained me a lot on how important it is to include, because people walk by and go, "Oh, pick up that trash, you dirty slot," and I've seen it all. I mean,
Yeah.
every 3 times a week they would come and scoop. We have a bridge there, and they'd come and scoop up all their stuff and make a move, and they'd move over to our
Yeah.
place. And they made a law about it. It's a so no sit, no
Yeah.
lie law, and
Yep.
it's very traumatizing. I would be traumatized just driving in to see it.
I
So
know.
yeah, so
I think.
I've been able to do that, but this is a situation I'm just at awe with. But thank you so much for
No,
your
thank you for
insight.
sharing that, Angela. I appreciate it. And it's a great reminder, of, everything you said is a great reminder for everyone just to remember, that a lot of people are coming with deep rivers of stuff, right? I like that analogy.
Yeah, yeah,
Thank you.
yeah. Thank you.
Anybody? Oh, sorry. Hugh?
Yeah, hi. I
Hey.
was just wondering, I loved the advice about getting people involved with animals. I think that is so great. I literally cannot fucking believe that that never occurred to me. I'm vegan.
Yeah,
But thank
animals have
you.
really, I've been able to do a lot of things to get people to do things or to engage in. I call it an engagement tool, right? Because I don't call it a service, I call it an engagement tool. It's a tool that I use, and we all have tool belts with all the different things that we can utilize. Because we have to meet people where they're at. And what is that connection? We all have different ways that we're things that we're passionate about. But the animals I feel have done a lot for me to be able to get to people's hearts because a lot of times folks who have been through trauma, the animals are the one things that is the constant in their life that have not traumatized them. So it's the one thing that a lot of folks can connect with across the board. But thank you, Q.
Yeah, for sure. And I was just wondering, because especially for my folks, I mo work with mostly like single elderly adults, single
Mhm.
disabled adults.
Yeah.
And I am trying desperately to get folks reconnected with their communities, to like get them, and we're scattered site. I'm part of a scattered site
Yeah.
model. Um, so I was just wondering if you had any other advice or any resources even for me to just look at, because I'm really trying to see if I can get my clients re-engaged within society. They're always talking to me about their loneliness. Um, and I know how devastating that can be for your health, mental, physical, everything. Um, but I'm really having a big challenge with that. It seems really difficult for me to be able to help my folks get back out into society again.
Can you email me, Q, and then that way I have your email address, and
Yeah.
then we can kind of I can start to send you some stuff that with my ideas because I can't just it's I organically think about it, especially for your area as well. So what
True.
I'll do if you email me, I'll have your information. Then that way we can
Mhm.
communicate together. Okay.
I will definitely do that. Thank you so much.